Welcome to another edition of the Health Insurance Store podcast, webcast. Actually, it's a webcast now. I get confused. We've only done 5 or 6 after a few months of doing podcasts. So, you're going to have to bear with me. I'm always a little bit slow with the learning curve of getting into this new technology in the 21st century here. So, bear with me. I'm going to fidget back and forth from time to time. Someday we'll get this. We'll be experts on this, but for now you'll have to bear with me. My name is Aaron Zolbrad. I'm the president and founder of the Health Insurance Store that was opened in April of 2008. We've been at this for quite some time now. What we do at the Health Insurance Store, is the name kind of implies what we do. We are a place you can come shop for all things health insurance. Medical, obviously, if you're a small employer and you want to, or a big employer and you want to provide insurance to your medical benefits to your employees, we think that's a fantastic thing to do for them, a great way to keep your quality employees. If you're an individual who has a job that doesn't provide insurance, or you have a little small business, maybe a 1-man or 2-man plumbing, electrical outfit, and you want to get insurance for you and your family, we do that as well. But what we do most of is Medicare, and that's what we're going to talk about today, is some nuances of Medicare. Just so you know, we're brokers here at the Health Insurance Store. We represent all companies, all products. It's a one-stop shop. Again, hence the name store. That describes exactly what you would do, like you'd walk into a store and shop for different kinds of ketchup, although there's only one kind, in my opinion, that's Heinz. But you can shop for, anybody that makes ketchup, you can shop for in a grocery store. Pretty much anybody that sells health insurance products, individual, group, Medicare, we're going to be appointed to provide those companies to you, so you're going to get some unbiased advice. The website is getyourbestplan.com. That's getyourbestplan.com. Phone number 724-603-3403. And, of course, you can check us out on Facebook. Just search for the Health Insurance Store, and there you will find us. What we've been doing mostly on our webcasts is we've been discussing in depth the column questions that I've been getting. Again, I write a column every Friday in the Pittsburgh Post-Gazette. It's on page A2. It's called Ask the Medicare Specialist. It also runs in the Tribune Review on page A7 every Tuesday. You can also go find those on the digital editions. But we're going to take this question and we're going to expound on it a little bit. Okay, we're going to talk much more in depth than what I'm able to do in the small space that provided in the column. So we had a question from Donna, and Donna's asking about the patient assistance program again. We've talked about this several times. We're going to continue to talk about it. The patient assistance programs were set up by drug manufacturers, big drug manufacturers, and I'm not sure, it's kind of a way to keep the government off their back. They're kind of providing, but they do provide medications at a discounted cost or for free to certain people. It's not something they advertise in neon lights. They don't want to give drugs away for free to everybody, but it is available, and we're kind of rolling the curtain back on this thing, and we're trying to get this out to everybody. So basically, recent discovery of a ton of diabetic medications that people can get for free, very expensive diabetic medications. We're going to talk about that a little bit more. You can go to my previous webcasts and take a look at that and podcasts and hear a little bit more about these patient assistance programs. They're fantastic. It's a wonderful thing that's happened for us, a huge development for seniors. So let's go to the question from Don. Again, the patient assistance program are great for diabetics who are taking insulin and other expensive drugs. However, they won't pay for insulin for those of us who have pumps. I have an Advantage plan and must pay 20% of the retail cost. Can you explain why that is and why the assistance programs won't help me? Well, a quick answer. I actually did confirm, after Donna sent me this message, I did confirm that the 2 best patient assistance programs will provide insulin for use in pumps if your pump takes a vial. They will provide that, or I believe a cartridge too. So that's great news for people like you, Donna. But let's quickly review again the programs that you're speaking of. So let's keep it simple, because if you want to get in real detail about these, you can listen to some previous podcasts or go to our webcast. So we recently discovered that several drug manufacturers have made many of the most commonly prescribed brand name diabetes medications available for free to anyone at or below 400% of the federally poverty level, which is basically $51,000 for a single person. Let's go take a look at that. $51,000 for a single person. Right there it is. $51,000 for a single person and $68,960 for a married couple. So that is the income. If your income is that or less, and that is going to be based on, it can be they're accepting quite a bit of different kind of proof of that: a tax return, Social Security statements. If you get a statement from your retirement company, if you have a pension, they're pretty liberal about this. They're not being crazy about trying to verify. On the applications, you'll see there's nothing that says in the two most popular ones with the most medications, there's nothing that says, oh, we're going to verify you agree that we're going to verify your income with the IRS, or we're going to check your credit report to make sure. On the two most, they're pretty much taking your word for whatever you send into them, so keep that in mind. But that is the income limit right there that you see on my screen. Now let's go to the list of medications that are being covered here. So we've got these insulins that you can see here: Tresiba, Levemir, Novolog, Novolin, Humalog, Humulin, and Basaglar. I would probably say that those are probably 75% or more of the most commonly prescribed diabetic medications, insulin right there. So that's not it. Now, the new spanking brand new stuff that we're meeting so many clients that are on are what I guess they're called non-insulin injections. These are for people with type 2. They're not even type 1. And these are the most expensive medications. These are more expensive than insulin. And I'm going to tell you, as you're going to discover, I'm not a big fan of Big Pharma. I think they are gouging Americans. Prescription drugs are less expensive retail-wise all over the world. We are the most expensive country in the world for medications. There's a lot of reasons for that. We'll get into that. We've gotten into that some other podcasts as well. The bottom line is these drugs can be anywhere from $500 to $1,000 a month. Trulicity, Victoza, Ozempic, and Tresiba. Again, these are the non-insulin injectable medications that you can get for free if your income is less than that right there. If your income is less than that, $51,040 as a single person family, $68,960 as a married couple, all of these medications can be provided free for you. There's the insulins again: Tresiba, Levemir, Novolog, Novolin, Humalog, Humulin, Basaglar, Trulicity, Victoza, Ozempic, Tresiba, the non-insulin injections. And there you have two type 2 oral medications, Januvia and Jardiance. Jardiance, the income limit is a little less at 300%, but again, free if you qualify income-wise. I want to make this clear. It does not matter how much money you have in the bank. It does not matter if you own property. It does not matter if you have 4 automobiles. It doesn't matter if you have $600,000 in a 401k. It's what your income is today. That's what determines your qualification. So let's go back. Let's get back into the question a little bit more. Let me add that if you do have questions regarding this, or if you'd like an application for one of these programs, we have them handy. Just simply email me, Aaron@getyourbest.com. Aaron@getyourbestplan.com, or you can call the office at 724-603-3403. 724-603-3403. We'll provide those to you. No cost. There's no cost for any consultations. There's never any cost for help that we provide to people. This is just something that we feel like we need to do as community outreach. I mean, again, I've seen people struggle with medications, especially diabetic medications, for the 13 years I've been doing this, and it's terrible. And we come across these programs. We want to make sure we get these out to as many people as possible. The applications are pretty simple to fill out. They're 2 or 3 pages. The hardest thing you're going to have to do is get your doctor to fill out their portion. And there's a couple hoops to jump through, but all in all, trust me, well worth it. People with these programs are going to save $1,500 to $4,500 a year with these programs. So let's get back into Donna was saying the insulin pumps weren't covered by these programs. Again, the insulin that goes into insulin pumps. They can be, yes. Sometimes yes, sometimes no. For the ones I've listed here, you should be okay. But I want to go over something because insulin pumps and the insulin that goes in them are covered different for the 2 types of plans that you can buy. So we have supplements, right? Supplements are called Medigap policies. You get your Medicare, original Medicare A and B, a supplement, aka Medigap's, designed to fill in the gaps that Medicare doesn't pay. Namely your $1,400 hospital deductible and the 20% for Part B outpatient services. Okay, covers that. People on supplements pay little or nothing out of their pocket for all medical services. Then you have Advantage plans. They're HMOs or PPOs. We talk about the differences in almost every podcast and every webcast we do, and that's because the confusion never stops. People are always confused about them. Advantage plans are basically a replacement you can call for Medicare. Basically, they pay in place of Medicare. So instead of Medicare paying 80% of your bill, Medicare pays the private insurance company of your choice about $800 a month to become your one and only insurance company. That's why if you have one of these HMOs or PPOs, you don't show your Medicare card at a doctor, hospital, or lab because Medicare's out of the picture. They've done their job by paying the insurance company $800 to become your one and only insurance company. They're paying them to provide you with health insurance and pay all the bills. Now, there's a big difference. Again, supplements, everything's covered. Pretty much, you will pay little or nothing out of pocket between Medicare and your supplement. With Advantage plans, you're going to have co-pays for everything. Practically, it's going to be co-pays for a specialist visit, blood work, x-rays, CAT scans, MRIs, hospitalizations, chemo, radiation, skilled nursing, et cetera, et cetera, et cetera. Well, why would anybody do that? Well, because you can save a lot of money in premiums with Advantage plans. And if you stay relatively healthy, which we're going to talk about over and over, you can save money by going to an Advantage plan. Now, there are some dangers. An insulin pump, if you're on an insulin pump, this is a huge danger for somebody to take an Advantage plan. Here's why. Insulin that goes into an insulin pump is a Part B, as in boy. Part B as in boy benefit. That means it's a medical benefit. It's not a prescription benefit. It's medical. So those who have a supplement, Medicare would pay 80% of the cost of the pump and the insulin that goes in it, and the supplement come in and pay the other 20%, and then those who have supplements would pay a big fat nothing for insulin that goes into a pump. However, when you're on an Advantage plans people on Advantage plans aren't provided the same level of benefit when it comes to insulin that goes into a pump. Okay? So people who don't qualify for the patient assistance program, or there is one of these you're not taking, insulin that goes into a pump, and don't qualify for that, you're going to pay 20% of the cost, because here's the deal. Advantage plans only have to cover benefits the same or better. They must cover benefits the same or better than Medicare does. So original Medicare only covers insulin that goes into a pump at 80%. Now, if the Advantage plans wanted to cover that better, like they do for lots of things like hospitalizations and CAT scans and x-rays and so on and so forth, emergency room visits, they cover it better than Medicare, but in this case, they only cover it the same. So they're only going to cover 80% of that pump, of that insulin that goes in the pump. So those people who are taking insulin, they're going to have to pay 20% of that cost. Now listen, a vial of insulin now is $500. Anywhere between, $350 and $500. And a lot of people might use 2 vials or even 3 vials in their pumps a month. So imagine if you had $1,000 worth of insulin that needed to go in that pump a month and you had to pay 20%, that's $200. So again, this is where you got to really know the difference between Advantage plans and supplements, and you better make sure somebody's explaining them right before you go enroll in a plan, because unfortunately a lot of times other agents, or if you call a company directly, they're not going to say, "Oh, excuse me, ma'am, sir, do you take insulin? Do you take any is it a pump?" They're not going to ask you that a lot of times. And even if they did ask you, or if it came up, they may not tell you, "Oh my gosh, this might not be a good plan for you because you're going to have to pay 20%. You're probably not going to say, "Well, you should really take a supplement because a supplement would pay for that for you." So somebody may think, who took a zero premium plan or took a $20 plan or a $50 plan that's got all this dental and vision and all this stuff, that you're thinking, "Wow, this looks like a great deal. I can, they're going to pay for some fillings and cleanings, and I'm going to get a free gym membership." And well, guess what you didn't take into account? You might have to spend $400 a month on your insulin. So how free was that gym membership if you spent, $4,800 on insulin a year? Well, it wasn't really free anymore. That teeth cleaning that they say they were providing, that they're going to provide for free, it's not really free anymore. Okay, a supplement won't provide that stuff for you, but guess what? That $4,800 worth of insulin is going to be covered. So very, 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 very important. So again, I'm not anti-Advantage plans. We have over 4,000 clients on Advantage plans, and there's several reasons to choose one. The best, in my opinion, is a low cost from $0. We almost never, when I say almost never, I mean 99% of the time, we tell people don't pay more than $60 a month for an Advantage plan. Almost every person we advise to take, or who wants an Advantage plan, says, "Aaron, I think I want one of these." We advise not to pay more than $60 a month for one. If you're paying more than $60 a month for an Advantage plan, you're paying too much, you need to call us, let us review it and show you why. Sit down and compare them side by side on paper and show you how you could be getting a much better value on an Advantage plan that's less money. So again, the logic of going to an Advantage plan is you can save $5,000 to $10,000 in premiums over a 5 to 10 year period. And those who stay relatively healthy can indeed do just that. And, I've had several clients that have had an Advantage plan for 10 years, and the most they ever spent out of their pocket was a couple $100 for, say, a cataract surgery. So those people paid a lot, they saved a lot of money. However, for every one of those people, for every 20 of those people, you might find somebody who ended up on insulin and a pump, and now they're spending $3,500 to $4,500 or $6,500 out of pocket every year, and it didn't work out for them. Are you willing to take that risk? That's what you need to understand when you sit down and it's time to choose a Medicare plan. And if you've already chosen one, it's not too late to go over those risks, okay? Again, Advantage plans, not without risk. One of which, again, we've just talked about is the possibility of paying thousands of dollars for medical services and reaching what is known as the maximum out-of-pocket, known as the MOOP, M-O-O-P. This represents the most you can be billed in a calendar year, and I estimate that close to 50% of all available West plans in Western Pennsylvania have a MOOP on the higher end. Only 2 plans are available in Western Pennsylvania with a $3,400 MOOP, maximum out-of-pocket. And we prefer our clients stay on the lower end of that. Now, sometimes it's not avoidable. We got to go into the $4,900, $5,900 out of pocket. There's a couple very popular plans that have MOOPs of $4,900 or $5,900. We have plenty of people enrolled in those. But again, if you had a plan, one of the most popular plans in Allegheny County right now has a MOOP, a maximum out of pocket of $5,900. If you need chemo, if you need insulin pump, if you have an insulin pump and need insulin, if you need to get Remicade therapy, which is expensive infusion therapy, if you wind up in a skilled nursing facility for 40 or 50 days. Some plans, if you have multiple 5-day hospitalizations, if you get a prosthetic device, you have a high-dollar piece of durable medical equipment, you have a ton, 50 or 60 radiation visits, there's a really good chance you're going to meet that MOOP, which again are between $3,400 and $6,700. Big risk. Again, we just talked about this. Advantage plans are regulated to provide the same or better benefits than original Medicare, and in most cases, much more generous for service such as emergency room visits, hospitalizations, outpatient surgeries, blood tests, x-rays, radiation therapy, and others. And we talked about this too. They can also provide benefits Medicare and a supplement don't. We're talking about cosmetic dental, vision, hearing aids, free gym memberships, over-the-counter services. That's a new benefit Advantage plans came out with a couple years ago. They're going to give you an allowance to order this stuff out of a catalog. You can get vitamins, acetaminophen, ibuprofen. You can order Band-Aids, toothbrushes, dental floss, you name it. You can walk into a drugstore and whatever you can grab off the shelf is available in this catalog. And some companies are giving $40 a month for you to spend on that kind of stuff. So those are things you're not going to get with a supplement. And I understand those are definitely incentives to join these plans. And again, if we stay relatively healthy, they become a great value. Remember, but there's areas where coverage is only as good as Medicare. Chemo, 20% of the cost. Infused drugs, 20% of the cost. Those on supplements aren't going to pay anything for these. Skilled nursing can be $176 a day after the 20th day. Durable medical equipment, 20% of the cost. Diabetic supplies can be 20% of the cost. All these things I'm saying that are 20% or $176 a day, those on supplements pay zero for those. Okay? Which leads us to another risk of going with an Advantage plan. This is the one I consider to be the biggest risk of those who choose Medicare Advantage plans, and that's the possibility of never being able to enroll in a supplement at a reasonable cost again. Someone's going to need chemo on a regular basis, and I've met several, trust me, over the years. Those who have an insulin pump or get regular Remicade injections or other infusion therapy. Those people are not only likely to be out of pocket $3,400 to $6,700 maybe every year or every other year, but they probably won't be able to get into a supplement ever again that would eliminate those bills. And that's because, as I've written again on numerous occasions on the columns and talked about probably in 50% of the webcasts and podcasts, supplements can medically underwrite, meaning they can discriminate against you based on your current or previous health care or your previous conditions, current or previous conditions. So if you've had a stroke a year and a half ago, there's no company that will take you. If you've had cancer within the last 2 to 5 years, there's no company that will take you. Some cancers, there will never be a company that can take you. If you've had melanoma, because it's a cancer that never goes away. There's only one company that will take you if you're insulin-dependent diabetic. And if you have certain conditions, neuropathy, or then you won't be able to take those either. So, you got to keep that in mind when you make your decision. The There are some exceptions where supplements have to accept people. The first is going on Part B for the first time. If you're leaving coverage from an employer, or you're leaving a company, you're moving off retirement benefits, there are some exceptions there. But for the most part, if you choose an Advantage plan first, and you've had that for a year longer, and you're an insulin-dependent diabetic, you've got an autoimmune disorder, you've got any kind of you're probably not going to get a supplement ever again. So remember that, please. Again, it's just another reason why when you turn 65, when you go on Medicare for the first time, if you're retiring from your job after 65 and you're going on Part B for the first time, let us help you do this. Let us help you wade through all these risks. Let us present the risks and rewards to you so you understand, what are those risks? What are those rewards? Am I willing to take that? You've got to weigh that in your mind. I remember, I've been in, I kind of consider myself more of a consultant now than a salesperson, but, I've been in sales a long, long time. And I remember, some of the advice I got when I was training people, when you have somebody who's having a hard time make a decision, we used to call it the Ben Franklin example. Ben Franklin, when he was weighing a decision he was going to make, he'd list the positives and the negatives on a sheet of paper, one on one side, one on the next. And he would look at them side by side, and that's how he'd help make his decision. That's basically what we're going to do for you. We're going to list all those positives and all those negatives, let you weigh them out, and ask us questions about it, and then we're going to help you make the best decision for you. Okay, not for us, for you, because everybody's different. Everybody has some different situations. So please call one of our offices or email me for more details on the patient assistance program. Or if you've got any questions like Donna had, she didn't think she qualified for the patient assistance program, could get her insulin for free, and we found out she can. So that is wonderful news. Also, again, keep tuning into the webcasts. We're always adamant about educating our clients on the pros and cons of both Advantage plans and supplements. So I've met too many people to count who not only didn't have those explained, but weren't even told about the supplement option. You got to have that explained to you. You got to have both explained to you. I have people that call me up and want to just, Aaron, I've read your articles. I want a plan and supplement. So, wait a minute. I need to tell you about the Advantage plan option first. You got to know both options. But I've had too many people who enrolled in an Advantage plan, weren't even offered a supplement option. And if they were told, listen, it's very vital that as a person on an insulin pump, you take a supplement while you can, the first time you can, because you never can again. And then they couldn't get a supplement forever, and were out of pocket thousands and thousands of dollars out. Thought they were saving money because, oh, wow, I could get a $40 premium as opposed to a $100 premium. That's $700 a year I'm going to save. Well, not really. Okay, we're going to talk about that in another webcast, is what we call a total cost of ownership of a plan. There's more than just what the premium is. Be that a supplement or an Advantage plan. We got to talk about it both ways, okay? We'd like to remind everybody we are now able to resume face-to-face appointments for those who prefer them. Hopefully that will continue. I know that the COVID cases are up. I know in Allegheny County they're ceasing the sale of liquor in most bars, or in a lot of bars. I will tell you we have taken all precautions and are following all CDC and Pennsylvania guidelines for people coming to our office. But those who are not comfortable yet, and I get it, there's plenty of those out there coming in. We can still do a meeting over the phone. We can still do a Zoom meeting consultations where you can see me kind of like this, and I can show you documents. It's pretty close to being sitting across the desk from an individual, so we can do those too. And remember, there's no cost for our services. There's never any cost for our services. So we want to invite you back. I want to give you the website one more time, www.getyourbestplan.com. I want to take you there and actually show you how you can subscribe to our webcast if you'd like. So if you look here and you look on our webpage, you'll see over the top right where it's next to Get in Touch, it says Webcast Gallery. If you press that button, it's as easy as clicking the subscribe button up here on the right, top hand right, and now you're subscribed to the YouTube channel. A lot of people don't want to do YouTube. If you don't want to look at my ugly mug, I don't blame you. If you want to just do podcasts, again, you can see our podcast gallery here. You just click on it. Below my picture here, there's usually something. I've already subscribed to it, so I can't do it again, but there'll be a place to subscribe down here. You'll enter in your email address, and then they'll give you email updates when we do a new podcast. So you're going to hear the same. You just won't be looking at me. So if you like to listen to podcasts in your car, we love you to do that. Pass it on to friends and family. Website, getyourbestplan.com. Phone number, 724-603-3403. We do have 3 locations in Western Pennsylvania, Erie, Connellsville, and beautiful Fayette County, and our Allegheny County, Pittsburgh office is in Forest Hills on Ardmore Boulevard. you can always stop into one of those places now for the time being when we're still allowed to see people. So again, thank you so much for joining us, people. We really, really appreciate it. Want you to keep tuning in. Keep following us. We're going to get more in depth as soon as hopefully we'll get some people in the studio and have some guests. And again, we're going to peel back this curtain, man. That health insurance is a crazy gig. You know, it's funny that, could you imagine, one thing that drives me nuts about healthcare is, could you imagine taking your car to the shop and saying, I need a brakes done, and them saying, okay, just drop it off. And you say, how much is that going to be? Oh, we'll tell you when we're finished. We don't know. That's what we're dealing with healthcare. You go to the hospital and you have a bypass surgery, and you don't know if it's going to be $30,000. Well, we don't know till we're done. We don't know what codes we're going to enter in yet. It's crazy. Even a regular office visit sometimes can be coded differently. So these are the types of things we're going to get into, folks. So just again, stay tuned, keep watching. Everybody stay safe out there, and we will see you soon. Thank you again for joining the Health Insurance Store webcast. Be safe, everybody. Thanks for listening, folks. Join us again soon as we interview those on the front lines of healthcare, health insurance, Medicare, and our ongoing prescription drug crisis. My name is Aaron Zolbrod, and we look forward to helping you get your best plan at the Health Insurance Store.